Hey friends, welcome back to Inside South Florida. Thank you for spending your time with us today. And our next guest is known affectionately as America's favorite nurse. Nurse Alice Benjamin can be seen everywhere, and she joins us now to help bring attention to National Minority Health Month. Nurse Alice, welcome to the show.
Hi, thanks for having me, Jason.
People of color are disproportionately affected when it comes to receiving the best health care. Why is this month so important?
You know, it's really important because of health disparities. I mean, you have situations where Black women are 3 times more likely to die from pregnancy-related causes. You have people who, based on your zip codes, are more likely to have a shorter lifespan, and African Americans, greater risk for colon cancer, going to, and fare worse than our white counterparts. So these are just some examples of health disparities. And so this is really our opportunity to address these issues, raise awareness, and work together with the community and providers to help find interventions to help eliminate these disparities.
Nurse Alice, what tips do you have for us to get and maintain better healthcare?
Right. So if you're someone who's going to be accessing the emergency room, I have 5 tips, and those are to first keep a list of your medical history, medications, and your allergies. This is key because when you come in, you don't feel good. You may be a poor historian of what's gone on with you in the past, and so we really need to have a list of your medical conditions, any medications you may be on, because these are going to provide the blueprint of how we move forward with things. Certain medications, certain disease processes put you at high risk for things. And if you can't remember it or you're out of it and can't tell us, we can look at a list perhaps in your purse, in a notebook, and that will help us keep that in mind as we move forward in your care. Number 2, focus on your biggest issue. Now, I know you might have a laundry list of things that are bothering you. And yes, all of those are important. However, it's an emergency room. We want to focus on your most life-threatening condition and stabilize that first. So that's what we want to work on. So what brought you to the emergency room today? When did it start? What makes it worse? What makes it feel better? Tell us as much as you can. And we're going to focus on that first. And then once that's situated, then we can work with yourself and your primary care provider for the other issues. Something else that's very important. Make sure someone knows you're at the hospital. So whether you bring some with you or you have them on speed dial or they're FaceTime with you as you're walking in through the door, we want you to have a support system, someone who can be there with you to listen as the doctor or the nurses are talking to you, so you can be reminded of what was said when you get home. And as well, someone who can help advocate for you or help remind you about what really went down yesterday when you felt woozy. Also, honesty is the best policy. I know sometimes we might be shy or we might feel like we're disappointing our healthcare provider, but I want people to know we work for you. There's nothing you can tell us, nothing we haven't seen, nothing we haven't heard. We really want to know, where are you at with things? What did you take? What did you do? Who are you with? What happened to you? That way we have a good baseline of where to go and we can help work through those differential diagnoses. But if you don't tell us, we won't know, and that might waste some time, and time is tissue. And lastly, Jason, we really don't want anyone to delay coming to the emergency room because of costs. I know the ER, people, their horror stories of their ER bills, but listen, we would rather work with you on a payment plan. Perhaps your insurance will cover more than what you believe they might. There are for programs of forgiveness where they can even swipe away your ER bill if you can't afford it. But we'd rather do that and work with that versus having to pay or plan for a funeral. Quite honestly, your life is too precious for you to be worried about what that bill's going to be when you come on out of the emergency room.
Lifesavers there, Nurse Alice. Where can we go for more information?
You can visit my website at asknursealice.com. Tons of information about this very topic as well as other health topics. And you can always find me on social media at Ask Nurse Alice. All socials, IG, Facebook, TikTok, Ask Nurse Alice. And hey, ask me. I'll be happy to answer your questions.
Love it. America's favorite nurse, Nurse Alice Benjamin, keeping us healthy this National Minority Health Month. Thank you so much.
Thanks, Jason, for having me. Bye, everyone.